Well, hello and welcome to Quinnipiac University's COVID-19 Vaccine Community Conversation, Empowering Communities, Informing Decisions. My name is Janelle Tresera, Dean of the School of Health Sciences at Quinnipiac University, and I'll be serving as the moderator for this conversation tonight. The Food and Drug Administration authorized Pfizer's COVID-19 vaccine for emergency use on Friday, clearing the way for millions of highly vulnerable people to begin receiving the vaccine, marking a historic turning point in a pandemic that has taken more than 300,000 lives and inflicted close to 17 million people in the United States. That authorization set off a complicated coordination effort from Pfizer, private shipping companies, state and local health officials, the military, hospitals, and pharmacy chains to get the first batch of doses of the vaccine to healthcare workers and nurses and nursing home residents as quickly as possible, dodging a winter snowstorm, all while keeping the vaccine in ultra cold temperatures. That is nothing short of amazing. The headlines in the New York Times this past Tuesday read, "Healing is coming, US vaccinations begin." With that, I believe, came a collected sigh of relief across the country, a country that has suffered for so long in so many facets of our lives. And now hope exists that we will move through this pandemic. But despite the collective sigh of relief, there are still concerns that people have about the vaccine. So we're here today to hopefully answer some of those questions that you may have. We are so honored to have our esteemed panelists from within and outside Quinnipiac joining us tonight with expertise in medicine, law, basic science, business, nursing, social work, and even a superintendent of our school systems here today with us. I believe we have enough experts here to begin our discussion on COVID vaccines. Keep in mind, this is the first in a series of webinars that we will be hosting over the next few months as we work through this pandemic together. The purpose of this really is to be here to answer questions that you may have. Panelists, I was wondering if we could just take a moment quickly to briefly introduce yourselves. David?
Good evening. Welcome, everyone. I'm pleased to join you tonight. I'm David Hill. I'm a professor of medical sciences at the Netter School of Medicine at Quinnipiac, and I also serve as the medical advisor to the COVID-19 task force for the university.
Thank you, David. John?
John Thomas, I'm the Quinnipiac Law School, where I teach health law.
Wonderful. Thank you, John. Maya?
Hi, everyone. I'm Maya Doyle. I'm an associate professor of social work in the School of Health Sciences, and I was also a hospital-based social worker for about 20 years before my time at Quinnipiac.
Thank you, Maya. Jeff?
Hi, I'm Jeff Mattal. I'm an associate professor in biomedical sciences. I'm a microbiologist and I teach immunology at Quinnipiac.
Wonderful. Lisa?
Lisa Kachura. I'm a professor in biomedical sciences in the School of Health Sciences, and I teach immunology and infectious disease at Quinnipiac.
Great. Thank you, Lisa. Mary?
Good evening. I'm Mary Peterson. I'm a clinical assistant faculty in the School of Nursing. I'm the director of the Accelerated Nursing Program here at Quinnipiac and a practicing pediatric nurse practitioner.
Great. Thanks, Mary. Mario?
Good evening. I'm Mario Norvis in the Management Department in the School of Business.
Great. And Jody?
Good evening, everyone. I'm Jody Goller, Superintendent of Hamden Public Schools. Glad to be here.
Great. Panelists, thank you so much for being here. We appreciate your time and your expertise tonight. Before we begin, I'd like to go over just a few important webinar points. First, this presentation will be recorded and available on demand shortly after it's completed with transcription. Second, we encourage you to engage with us by asking questions in the Q&A feature that's at the bottom of your screen. You can ask questions using your name or you can ask them anonymously. Finally, if you see a question that comes up that's relevant to you, you can upvote that question by hitting the thumbs up icon, and that will cause the question to jump up to the top of our Q&A box, and hopefully we can get to that question a little bit sooner than later. So without further ado, I want to go ahead and get us started with a few questions. So the Pfizer vaccine has been approved, delivered, and administered, and today the FDA Advisory Committee is considering a second COVID vaccine from Moderna. So I want to get us started just by panelists, you giving us an understanding of what these vaccines are and how they're intended to work. And I was wondering, Lisa, Jeff, could I start with the two of you?
Sure. Yeah, I'll talk about the Pfizer vaccine, and the Moderna vaccine is extremely similar to the Pfizer vaccine. The Pfizer vaccine is really elegant and really simple. It has 4 major components: RNA, which I'll talk about shortly; lipids, which we often think of lipids as fats; salts; and sucrose. So these are all things we've heard of before. The RNA that we put in the vaccine is going to teach our cells how to make a viral protein. And that's going to allow our immune system to mount a response to the virus, such that when we get exposed, we already have antibodies and other immune cells that'll help us fight off the virus. If you actually got infected with COVID-19, your cells would make about 20 to 30 viral proteins. So the vaccine is just having our cells make one single virus protein to help to expose our immune system. The lipids, the fat, they basically protect the RNA from being destroyed once it gets in our body, and allows it to get into our cells. The salts just give the vaccine a solution that's very similar to our body solutions. Then sucrose is just a sugar. It helps stabilize the RNA while it's being frozen. So once we get the RNA vaccine, it gets into our cells start to make this protein, and our immune system will respond to this protein. And the immune response is very interesting. This type of vaccine will get our antibody response, which is very important. That's typically what we think of when we think of vaccine responses to infectious diseases. But they've also done studies to show that we get a really good T cell response, which is another type of immune cell that's really good at fighting off viral infections. So we get a very well-balanced, broad immune response to these vaccines. The vaccine itself is very technologically advanced, but biologically it's extremely simple. It's one of the simplest vaccines that we have, because all we basically have is RNA, and then a couple things to help protect that RNA. So it's very, very simple and elegant vaccine. I think Lisa was going to talk a little bit about what's not in the vaccine, now that I've talked a little bit about what is in the vaccine.
Right. So as Professor Maitel said, that it's a pretty simple vaccine with regard to basically 4 components to it. So there's a lot of things that are not in the vaccine. And the first one is there is no virus in the vaccine, right? There is no live virus, there is no killed virus in the vaccine. So you cannot get COVID-19 from the vaccine. I think that's something that's on a lot of people's minds. If it was a live virus, it would be very difficult to give it to immunocompromised people. If it was a killed virus, people worry, well, what if something goes wrong? So there's no actual virus that's in it. It's also very simple, and it doesn't have preservatives in it. Thimerosal has not been in our vaccines for over 20 years. It doesn't have antibiotics in it. It doesn't have gelatin. It doesn't have neomycin, so some people worry about allergies to neomycin. It doesn't have adjuvants in it. There's a lot of things that are not in it that a lot of times people worry, like with regard to allergies or other types of chemicals. As he said, it's a pretty simple vaccine from the point of view of biology.
So Lisa and Jeff, thank you so much. So how is this vaccine being administered, and how long does that immunity last?
So it is administered in 2 doses, depending on the Pfizer versus the Moderna. It's a slight difference in the time between the 2. But we really don't know exactly how long immunity is going to last, right? So we only have a few months data on vaccine-induced immunity. We certainly have some inklings from immunity to other coronaviruses. So we have 2 parts of that question when we ask how long is immunity going to last. One is, how long will immunity last after infection? And that seems to be from 2 months to maybe 2 years. Coronaviruses don't seem to naturally induce a long-lasting immunity. We're hoping that this vaccine might be like some of the other vaccines, and it might actually last longer, but it's very possible that we would have to get this vaccine and get boosters of it on a regular basis. We don't have that data yet. We're following them. People that are in those trials have to continue to be in those trials for 2 years so we can follow that exact information. It's different than the flu vaccine. So a lot of people think of the flu vaccine as something you have to get every year. And we have to get that every year because the flu vaccine changes. So much like you might have gone out and bought a different winter coat this year, the flu virus actually changes every winter. So the changes in this coronavirus are very small and don't seem to be affecting immunity at all. So from that point of view, we don't have to worry about getting it but it's very possible that we will have to get boosters for this.
Wonderful. Thank you so much. So about a week ago, the most Googled question was, are COVID vaccines safe? And just today, I watched the news and heard that 2 healthcare workers from Alaska experienced, in one case, serious, and in the other case, less serious, allergic reactions after taking the Pfizer vaccine. So I have to ask this question, is this vaccine safe?
So I'll go ahead and maybe tackle that. This is David Hill. So in the trials, there were 20,000 plus individuals who received the Pfizer vaccine, Pfizer-BioNTech vaccine, and around 15,000 individuals in the Moderna trial. And in that, there were the expected local reactions, which might be a little bit of a sore arm, and then a higher number in the vaccine recipient group who had low-grade fevers, maybe muscle aches and pains for a few days. Not too surprising. These are symptoms that are related to most vaccines that you get, and these all resolved fairly quickly. Interestingly, the older you were, such as if you were my age, over the age of 65, you had fewer side effects. And so that should be a bit reassuring for older individuals who would like to get this vaccine. So during the trials, with tens of thousands of individuals who received it, there really weren't any worrisome signals. Since the vaccine has been given to more individuals, as Janelle just mentioned, there have been some allergies, so kind of an immediate allergic reaction. And that's why they're recommending that if you get the vaccine, you'll get it in a safe setting where any allergic reaction can be handled. And none of these, all of these have resolved with standard measures to intervene. So I would say I'm going to be very willing to get this vaccine when my turn comes up. I think these are very safe vaccines. It is true that when you give many more thousands and thousands and thousands of doses, we may see some side effects that weren't expected. But I think overall, given the makeup of the vaccine, the technology, and the trial data, we should have every confidence in the vaccine safety.
Great. David, thank you so much. And this kind of brings me to the second most Googled question, which was, what are the side effects? And I think you had alluded to that a little bit when you take it about local reactions, fevers, muscle aches. Are there any other side effects that we need to be thinking about that are related to this vaccine?
So again, the local ones typically are pain and redness and some swelling at the site of the injection. And those are typical for many vaccines. And then the others that have been seen have been fatigue, headache, fever, chills, some muscle aches and pain. So that's pretty much been it. And severe reactions have been very, very rare.
I like to think about those particular types of side effects more as kind of proof your immune system is working, right? So if you went out and ran a marathon, the next day your muscles would hurt a little. I know a few people who participated in the clinical trial that actually messaged me and said, I hope I have a few of those side effects, because they felt that meant that they got the vaccine rather than the placebo arm. So if you do experience them, they should be short term. And it's actually something that actually says, hey, my immune system's actually working and recognizing this as foreign.
I like that analogy, like warming up your engine.
Love it, love it, love it. Thank you so much. So I have to ask this question because I have heard people say, well, gosh, the vaccine is here. I'm so happy. I'm going to get my vaccine and we're back to normal. So I need to ask this question. After we get the vaccine, will we still need to take COVID-19 precautions, wearing masks, 6-foot distancing, washing hands, so on and so forth? Who would like to take that one?
So I can go ahead and jump in on this. Until we know whether or not the vaccine prevents colonization and how long the vaccine is effective, I think those who receive the vaccine and those who haven't received the vaccine should be wearing masks and practicing the preventive measures. And we're really going to be doing this probably for the next 6 months or more as we roll out the vaccine to more and more people. And even when most have been vaccinated, if there are large cohorts that haven't been, I think we still want to use preventive measures. So some of the questions are, will this vaccine prevent you from carrying the virus? We don't know that yet. We'll know that in another 6 months when we have more data from those who have received the vaccine. But for right now, it makes sense to continue our preventive measures. And so these are effective. We know how COVID-19 is transmitted. We know that if you wear face coverings and you keep your distance and wash your hands, that will prevent the spread of disease. So until everybody gets this and we're some distance away from everyone getting the vaccine, we still need to do these precautions.
Excellent.
I'll echo quick what David said. Yeah, we don't have the evidence yet. I know with the AstraZeneca vaccine, that's another vaccine on the horizon. They are going to look at colonization throughout. So they're going to follow people after vaccination and then look at whether what's called the viral load, basically how much virus is in your body if you do get exposed. So I think we will we'll have evidence from that vaccine trial. Hopefully, as David said, in a few months.
Great. That'll be great. Yep, go ahead, Lisa.
I was gonna say, the other part of that I get asked a lot is people who did test positive, will they have to get the vaccine, or should they still be wearing a mask and practicing social distancing? And we do know that some people have been reinfected, and the general thought now is that everybody will receive the vaccine, even if you have been positive. The timing of that has not been determined yet, but that everybody will be getting the vaccine.
Lisa, I'm glad you said that, because my next question was somewhere around the lines of, according to the CDC COVID tracker, more than, I think, close to 17 million people across every state have tested positive for the virus. The daily new cases exceed 200,000. So there are a large number of people with the virus, a large number of people who've been hospitalized by it, and probably a significant number of people walking around with it who don't even know that they have it. So I guess my question is, and I think you answered it, Lisa, is if you had COVID, the virus, or if you had a test that showed that you had antibodies to it, do you still need to get the vaccine, or are you exempt from it?
So again, we don't have, the exact data on that as far as following people for lengths of time, but we do know that people have gotten it, have tested positive more than once and have gotten it more than once. And we have looked at other coronaviruses and seen immunity waning. And in some of the patients that had been tested positive in March, those antibodies lasted 2 to 3 months. So the general feeling now is, yes, that those people will need to be vaccinated.
I can add a personal anecdote. I did contract COVID in the spring. I was very, very sick for a long time because I had cancer at the same time. And I was hospitalized. And when my spot in the line comes up, I will take the vaccine as quickly as I can in the hopes of helping protect my community.
Great, John, thank you so much.
Janelle, might I add one other thing sort of
Sure,
to our topic? Just thinking about, you were asking about whether people need to continue all those safety protocols of masks and hand washing and social distancing. And I think we all just have to remember to be patient. From a mental health point of view, we're all so anxious to get back to our normal lives and want that so desperately. And I think we may feel some frustration in the next upcoming months and even year while we're all waiting for this to really, us to reach a level of immunity in the community that's truly safe. And that we're probably going to be more patient than we expected to be until it's truly safe to sort of stop all of those things. I was looking at a photo of my son and his friends from a few years ago. This morning, we were talking about, when we can get them all together again and celebrate and party and play. And we said, you know what, we all realize we're going to have to wait a little while before we can do that in the same way. So I think it's just we have to sort of think about just the same way we've made it through this extended time of quarantining and being careful, we're going to need to make it through this extended time of waiting for the vaccine to really have reached enough people that we have immunity.
Maya, thank you. I appreciate that. So I want to ask a little bit more about the vaccine. So I understand that the clinical trials for the vaccines included young adults and adults, but what about children? So is the vaccine indicated for children under 12? And since we know that, I believe children are not as severely affected by COVID as adults, should they be immunized? Not sure, Mary, if maybe or David, Mary?
I'd be happy to start with that.
Yeah.
Right now, the vaccine is indicated, the Pfizer vaccine is indicated age 16 and older. There are clinical trials that have started very slowly looking about age 12 to 17 specifically. And there have not been any trials in younger pediatric patients. And, people know that children do not get as sick as adults do when they have COVID. There have been 154 pediatric deaths. Out of those, 50% of those pediatric patients did have underlying medical conditions associated with that. However, in the pediatric population, there's other things to consider. When children are sick, they have missed time from school, parents have missed time from work. So there's other factors that go into it. But one of the main ones is that in order to keep the community safe, pediatric patients also need to be immunized. Because they spread the illness. They can bring it home to their families. They could bring it home to vulnerable populations that may be exposed. So in order to keep even teachers, faculty that work in school systems safe, it's imperative that our pediatric patients do get immunized. The American Academy of Pediatrics is really pushing these pharmaceutical companies to get those clinical trials going in the pediatric population. And at this point, there's no reason to believe that it is not going to be as effective in the pediatric population as it is shown to be in the adults.
Great. Mary, thank you so much.
If I can segue on that.
Yeah.
This is not the only vaccine that we would be given to children as a main way of not having them spread it to us. If you think about rubella, children really have very mild responses to rubella as a disease. We vaccinate children mainly to protect pregnant women. So congenital rubella syndrome is the #1 reason why we really vaccinate against rubella. So it's not like this will be the first time we would be vaccinating children against a disease that might not be as severe in them as in an adult.
Great, Lisa, thank you. I do want to ask, I'm sorry, did someone want to add, Jeff?
I'll just add one more thing just to clarify that. It's not that there's any indication that the vaccine won't be effective or is not safe for children. Just when you look at how clinical trials are run, we always wait to start clinical trials on children under 16 until we have more safety data. Now that we have the safety data on these vaccines, I think they said early 2021 we should be having more data on children under 16. There were, if you look at the Pfizer phase 3 clinical trial, there were about 40 children from the ages of 12 to 16 in each group. So there were children in the vaccine groups, but just not in large enough numbers. And I assume those were at sites outside the United States, but we will be getting that information. But it has nothing to do with the vaccine not being effective or not being safe. It's just we always wait to give new things to our kids.
Great, Jeff. Thank you so much for rounding that out. So Jody and John, I think this next question might be for you. So Jeff had just kind of mentioned that come January, there will be more clinical trials regarding children and potentially a time where children under 16 become vaccinated. Could the vaccine be mandated for entry into school? So Jody or John, I don't know if you want to take this.
I can start with the legal part, and then maybe Jody can finish up with what the Hampden Public Schools are doing. So thrilled to have Jody here. So we know that the Connecticut general statutes authorize the Department of Public Health to mandate vaccines, and all of the parents out there know that the typical childhood vaccines are mandated in Connecticut with only one kind of exemption, a religious exemption. We also know that the Connecticut law only enables the Commissioner of Public Health to require a vaccine if the vaccine has been FDA approved for the population to which it will be administered. So can Connecticut now mandate that children be vaccinated with the COVID vaccine? No. Is it possible come fall 2021? Absolutely. And that will be a conversation that hopefully we'll have in the public. So most observers, legal observers, anticipate that this is coming with the exemptions that most states recognize. Again, Connecticut recognizes but one exemption, that is a religious exemption. And the General Assembly is considering removing that exemption. That's another conversation. So anyway, probably it's coming, but not until the FDA conducts not until the manufacturers conduct those trials in children, and not until the FDA approves the use for children.
Great. Jody, do you want to add anything to that?
I think John pretty much covered it. I'm not going to get into an argument with an attorney, certainly about this. I'll also say that fortunately, this is one decision superintendents don't have to make. And I'm not aware of any decision at this point from the State Department of Immunizations that require children to have require a COVID-19 vaccination for students to attend school. So we'll wait for their word on this.
Great, Jody. I am going to give you one more question, though. What are schools doing now? And can you help us understand what they're doing now to prepare for the vaccination program, and what kind of infrastructure within a school system can help our communities?
Yeah, so we started back in the summer with the reopening committees. All the school districts in Connecticut basically created reopening committees to rethink how our public schools are going to run. And so from that, we had various subcommittees, one of which is a medical subcommittee. And that's one group that's continued to meet on Fridays, just to go over, to review and analyze data, look at positivity rates and spread rates, and make determinations as to whether or not we can move back to full school, hybrid, or have to be in a remote setting. So in addition, the same committee, which makes up from Quinnipiac Valley Health District, Cornell Scott Hill, they're the organization that runs our school-based health clinics. And a principal from one of our elementary schools is also the head of the safety committee for our district. We meet as a medical subcommittee, and we've also morphed into a district vaccination task force. And the idea here is we know that eventually these vaccines are going to end up on our doorstep. So we need to do some groundwork prior to that moment to determine what our schools can do to support the efforts. You know, we're working with school nurses to train and prepare them to help with the vaccination efforts, to consult with our legal advisors, to assess logistical needs, prepare to help in any way we can. And also, one thing that's clear to us from this committee is the vaccines won't come in one big bunch where everybody will be able to be vaccinated. So we have to figure out how we prioritize vaccinating our staff. And that's going to be a very complicated issue. Who's most vulnerable could depend on age. It could also depend on the children you work with. So there's a lot going on with that. And in addition to that, we've done a lot with distributing meals. We've distributed since March over 310,000 meals with our partner, Whitson's, our food service provider. And we've also provided computer technology and Wi-Fi to ensure that all of our students have their devices available, and they can access they can access their education. And we also provide full opportunities for daycare as well, because in a hybrid plan, there are off hours a little bit for parents, and also there are remote days. And now we're in a full remote period through January 19th. So parents really need to get back to work. So we've worked with our child care providers right at school and the YMCA, and the board has significantly subsidized these programs to ensure that any parent who needs child care can access it.
Great, Jody, thank you so much. So I'm going to get to vaccine distribution here in just a moment, but I want to switch gears a little bit here to talk a little bit about some research that increasingly shows that racial and ethnic minorities are disproportionately affected by COVID-19 for a host of reasons. Yet people from racial and ethnic minority backgrounds appear to be nervous about getting the vaccine. The country's history of unethical testing and experimentation, I am certain, on Black men and women may have cultivated that distrust in public health systems. So I really want to know, what do we know about these vaccines as it relates to racial and ethnic minorities? Mario, maybe you can help with this one? Or others?
Mario, you're muted.
Oh.
Okay.
There you go.
Maya, go ahead.
Oh, okay, there we go. We're busy being nice to one another. So in looking at the Moderna and the Pfizer data in terms of who took part in the vaccine trials, you know, the participation in the trials does very much reflect the US population in general. So that's a positive. Janelle, you're absolutely right in that there is this legacy of huge ethical problems and mistrust with research, which then impacts who chooses to participate in research, which then leaves data gaps, which then creates mistrust. And so it's this really difficult cycle. There are many policies that try to address that and make sure that study recruitment does reflect the relevant, you know, clinical population that's affected. Of course, you know, while we've all been paying attention to the disparities of COVID, is that reflected in the research? Not necessarily, right? It reflects the US population. Does it reflect the disparities of communities of color that are so heavily affected by COVID now? Not as much as I might have liked to see, but it does reflect our population in general. The FDA publishes drug trial snapshots for every drug that is brought forward for approval. They have about 5 years of records available of all the drugs that have been brought forward if people want to look at them. Of course, 2020 is not out yet and there's nothing out available specifically about the COVID vaccines. But those snapshots over the last 5 years also represent a fairly good match with our US population in terms of who's taking part in studies. So we have gotten much better at that, but there are still gaps in terms of underrepresented populations. There are gaps in terms of women's representation. There are gaps in terms of older adult participation. So there's still a lot of work to be done. But from that point of view of who took part in the trials, we've done a fairly good job. The companies have done a fairly good job in making sure that they met the FDA's expectations, and that, you know, we're fairly well represented in the trials.
Great. Others?
Thank you. Agree with what Maya said completely. Now, data seem to show that different minority group behaves in different way. There is not a common behavior. For example, it seemed to show that Latin population is more willing to take the vaccine than the average, and the Asian population even more. Okay, the African American population is less willing to take the vaccine than the average. But the good news, I believe, across the board is that all those percentages are increasing. And certainly as people start seeing that, the vaccine have good effect and the fears have no place. So it will, all these percentages will increase. That's the hope.
Great. Great.
And Janelle, I'd just like to say that the trials for these two vaccines are actually very different than previous vaccine trials, which usually take either young and healthy children or adults up to the age of maybe 50 to 60 who are generally healthy. But because of the unequal burden of severity of COVID in those who are overweight, those who are older, those who have comorbid conditions, i.e. high blood pressure or chronic pulmonary disease or chronic renal disease, they specifically included those individuals. So for instance, in the Pfizer trial, 40% of the people in the trial were over the age of 55, and a third of them were overweight, and another high percentage had comorbid conditions. So these trials were actually very different than others. And the fact that the performance of the vaccine, i.e. the protective effect of the vaccine, has been so good in all age groups, in individuals who are completely healthy and those who are have chronic medical conditions, is really very encouraging and unique for these trials.
That's great news. That's great news. I want to switch to the topic of vaccine distribution a little bit here. We've been seeing on the news that the vaccine is being administered to frontline workers. And I would imagine that these employees were told by their employers how and when they could get the vaccination. So I'm curious, outside of those frontline workers, how will someone know when it's their turn to get the vaccine? Like for me, will something pop up on my phone? Will I get a call by a primary care physician? How will people outside of those frontline workers know when it's their time to get the vaccine, know where to get the vaccine, and what it's going to cost?
Well, I'll perhaps start with this.
Okay.
If you are enrolled in a primary care practice, all primary care practices in the state have submitted their details to the State Department of Health and saying, we have a practice, we have a patient population, we are interested in vaccinating our population. So over time, I just would ask people to be patient, that they will come up in the queue, in the line to be vaccinated. So your primary care practice will be notifying you at some point. If you are an employer, it's likely as well, for instance, at Quinnipiac, we've put in that we want to make sure that our employees and our students are vaccinated. And so we're in the line of individuals. So your practice, your employer will be reaching out. If you attend one of the federally qualified health centers, such as community health centers out of Middletown or in New Haven, Cornell Scott Hill or Fairhaven, they would also be reaching out to you. So I would say to be patient. Your time will come up. And if you do have any questions, call your provider. But this is going to be rolled out over the next 6 months. So, you know, the frontline workers, those who are in nursing homes, that's going to be the first group through December and probably early January. But by June, July, with a couple of products on the market, I think your turn will come up. So be patient.
Great, David. I've got one more follow-up question to that, and the cost. What is the cost of this?
So the cost is supposed to be free. So we'll see. Yes, it's going to be free. The government has purchased these. So for now, it's free.
Right. I'm going to ask one more question and open it up to Colleen to get to these on-the-fly questions from our participants today. But I do want to talk a little bit again about distribution. So Pfizer, they're still on track, I believe, to roll out their vaccines in 2021. But there was a $50 million dose shortfall, I believe. And it seems like, and as I was reading that, it seems like there might be a discrepancy between vaccine supply and demand, with the demand for it, as I understand, far outweighing the supply. So how should we be preparing for this from a capacity perspective? Can we presume that the manufacturers will be able to keep up with the demand?
Can I?
Yeah, Mario?
Okay. Thank you, Shamir. Well, this is a big issue. A big question is capacity and distribution. It is natural to expect that in case of a pandemic, at the very beginning, the demand will outpace the capacity. And there is another concern that is, so far, the manufacturing processes have been producing in the order of thousands or hundreds of thousands of vaccines. But now they need to scale to hundreds of millions, 100 million. Is to scale capacity is not a simple thing. It's not that cannot be done, but it's not simple, especially because it's kind of new, digamos, let's say, in this case. It is expected that over time, that's why the delivery is scaled, okay? Over time, everybody will have their vaccine as well as the second dose. But the production system, as well as the delivery system, need to catch up with demand.
Got it. And it does seem like it is a challenge, just with the Pfizer vaccine alone, shipping at -70 to -90, making sure that there are freezers there to take it. Will some of the ability for us to get other vaccines approved here quickly help with this supply and demand issue? or is it still a distribution issue for us?
Well, if okay, we have production and distribution. Okay, the question would be, where is the bottleneck?
Yeah.
Okay. At this point, it seems that the distribution is going very well. Okay, for the amount of vaccine that we have to distribute. As a matter of fact, two big companies like UPS and FedEx have said that they have no problem to get the vaccine wherever it has to go, in whichever. Now, when the moment is that Pfizer as well as Moderna put there on the floor all the doses that are necessary, well, we are going to see if then the bottleneck moves into the distribution.
Got it. Got it. Great. So this will
Janelle,
be,
can I just
sure, please, David.
just like to add to that? You know, in the old days, we had lots of providers of the vaccine. There were several companies that made tetanus vaccines and MMR vaccines. And then as there were lawsuits against vaccines and not as much perhaps money in providing vaccines, it came down to just a few manufacturers. But this is different. We're going to have lots of different manufacturers. We're going to have 2 vaccines approved by Friday, we assume. And there was a question in the chat there about how would I decide? Well, I think we're going to look at see, they look to be equal in terms of effectiveness, and we'll look at their side effects when thousands of doses are given. And having multiple manufacturers out there with highly effective products is all good news. So that's
David,
the best part of it.
Yes, I think that is the best part. I do want to make the point, though, that do we have to be careful about what manufacturer we get our first dose from? Does our second dose need to be from the same manufacturer?
I would say yes.
Okay. Okay. So if we started with Pfizer, we should end with Pfizer.
Yes.
Okay.
Yes, I would echo David on that. Yeah, you definitely want to stick with the same vaccine for the 2 doses. I'll also just make a quick comment that, you know, one of the nice advantages of an RNA-based vaccine is the pace at which it can be produced. RNA vaccines can be produced much faster than our traditional vaccines.
Right. Jody, did you want to add something?
And just a quick word as well. I think while school districts and towns don't manufacture vaccines, nor do we run trucking companies to distribute, the one thing we could all be doing now during this period of time is to really look at all of our people and see what we can do to put all the things in place so that when these do arrive, we're ready to vaccinate.
Perfect. Perfect. Okay. I am going to now open it up. Colleen, I want to go ahead and have us open it up to questions that are coming in from the audience. Do we have any questions, Colleen?
We do, Janelle, we have quite a few, and I appreciate the panelists who are jumping in and answering for us. Thank you so much. You guys are terrific. I have a question here about side effects. So back to the side effects of the vaccine, there's someone that had heard that the vaccine causes infertility. Is that true? So I wonder if anyone could address that. Maybe it's one of those things we need to clear up.
I hope they'll be almost in unison. The answer is no. Jeff, Lisa?
Yeah, no evidence of that whatsoever.
And a matter of fact, there were some people that actually did get pregnant in the trials, right? So even though we didn't recruit pregnant women for these trials, people get pregnant. So we actually did have some people that got pregnant during the trial.
And kind of along those lines, because there's a really good question in here about where to find the best information. So I think this leads us to that, right? That there's so much misinformation. And so I wonder if someone could comment on the best resources out there for the public to be getting their information from. Does anyone want to tackle that?
I mean, I think some of the best sources are the FDA, the CDC, and they're doing a much better job than they have, you know, in decades past about making the information easier to digest for the public, not just scientists. So going to the CDC, going to the FDA, they have really good documentation and websites where you can get good factual information in a kind of a easy to understand format.
Jeff, thank you. And Colleen, I do want to add, Lisa had added some links to the chat for you to go into the chat to see those links to those types of resources. We will also be pulling up a slide at the end of the talk with some sources for you, resources for you to get your most current information.
And I can just, mention that it's good to question, right? It's good to, this is something, there's a lot of media talk about this, a lot of coverage, a lot of uncertainty. It's great to question, but where you get your answers from is the important part. So from a scientist, from a healthcare provider, not from social media, not from, I heard something from somebody, but it's okay to question, that's good, but just get reliable sources for that information.
Thank you, Lisa. Colleen, I'm going to ask a question here that's in the Q&A. Does anybody know on the panel, and I hope you can answer this, how does the vaccine interact with prescribed medications? Do we know that?
So I could answer quick, and unfortunately the answer is we don't know. I think that's one of the things that will come out as the vaccine rolls out to more and more people. Typically, when you're looking at vaccine drug interactions, with the clinical trials, there's just typically not enough people in the trial that are taking the same type of drug to get statistically significant information. So I think as it rolls out to tens of thousands, hundreds of thousands, millions of people, will get more information on whether there are potential drug-drug interactions. I haven't seen any from the Pfizer and Moderna, but I don't know if David or Lisa has seen any of that information.
Well,
yeah, I think I'll speak and then go ahead, Lisa, but I think in general, vaccines and medications don't have much effect on each other. And remember that in the trials, a large number of people were on multiple medications for blood pressure, for diabetes, for other illnesses. And there was no evidence that their illness was made worse by the vaccine. So I would say in general that vaccines and medications is a pretty safe combination. Lisa? Yeah,
I was going to say that too, because basically the vaccine is inducing an immune response, right? I just say immune response if we got exposed to, the virus or exposed to another germ and antigen. So pretty much there's not an interaction. We don't consider it really a drug from that side. You don't dose it according to weight or anything along those lines usually.
So I did want to ask a follow-up to that. Are there any age concerns or comorbidities for individuals that should not be taking the vaccine?
No, as I've said, and the trials have illustrated, age up to 85 was included, and lots of comorbidities, lots of chronic diseases in individuals. So these trials were specifically aimed at those who had chronic medical conditions. So far it's safe in all hosts.
Great.
I think they are saying that if you have had anaphylactic reactions and needed to use EpiPens, that you really do consult your PCP first. I think that with those 4 reactions that we've seen, that people that have had to, use, not just people who have an allergy to, the cat or to pollen, but people who have had to use EpiPens should consult their doctors.
Colleen, do we have any more questions?
Yeah, we have lots of questions. And you guys are doing great though, and really answering what I think the public really wants to hear. And one of the things that has come up, and all of you have alluded to it a little bit, is how quick this vaccine really rolled out, right? This very short development period. And so as a result, people are questioning its safety. So someone in the chat very astutely asked, what can I use as a counter argument to people who say that it's not safe, that we put it out too fast? I'm not going to do it, I'm waiting. How do you answer that?
Great question.
Well, I think one of the first things is that yes, we have developed this vaccine very quickly, but RNA as a therapeutic, as a vaccine target, has been studied for decades. I think what happened with the COVID vaccine is that we infused billions of dollars into it and got it out very quickly. But this technology, this the idea of using RNA as a vaccine has been around for decades and has been studied for other coronaviruses. So the idea of an RNA vaccine is not new. What is new is that we have the the government and the financial support to spend, billions and billions of dollars to get it out quickly.
I'd like to add one thing and some reassurance that the United States was a little slower in approving these vaccines than other nations. So we did take a slightly deeper look, and that should give us greater confidence.
Great.
And if you think about coronaviruses, we've been studying them since SARS, right? So we've really been studying this since 2002, 2003 with the SARS epidemic. So we kind of had a big head start on this SARS-CoV-2. It's very closely related to the virus that caused the SARS epidemic. So I think from that point of view, it's not something rushed or new. And then if you look at safety data and efficacy, all of that gone through all the phase 1, phase 2, phase 3, that wasn't rushed. What was rushed was kind of the red tape. What was rushed is that we pre-purchased the vaccines, so that's the parts of it. It was more the bureaucracy that was rushed, not the science.
Great. I do want to ask a question. Let me see here. It just moved on me. I apologize about that. This one is for Jody, I think. How do you think school systems handle children whose parents refuse to get them vaccinated?
Again, I think just as everyone here said, I think we try to provide, and we do even now regarding information with CDC guidelines and other scientific guidelines regarding social distancing and appropriate behavior to be safe during this pandemic. We continue to just listen to the scientists, listen to the public health experts, and provide that information to parents and either attempt to answer their questions based on that information or direct them to the experts for further clarification.
Right.
I can add an answer to a related question in the Q&A session, which is, what is the percentage of children who are not vaccinated due to the religious exemption? In Connecticut, as of 2018-19, so a year ago, that was 2.5%. Between 2017-18 and 2018-19, the percentage grew by 0.5%. So it was 2% to 2.5%. So there is a slight movement in Connecticut toward anti-vaccination sentiment. And that's why the General Assembly has been thinking about removing that exemption. But anyway, at this point, about 2.5%. And I'd like our physicians to talk to us about the presence of herd immunity. If it's only 2.5% of, typically herd immunity is 95% are immune. You've got herd immunity, but somebody with more letters after their name might best answer that one.
So I'll jump in there, John. I think you probably have a lot of letters after your name, but in terms of herd immunity is the concept that if everybody around you is protected against the virus and you're in the middle of that herd and you're not protected, all those people around you will protect you. So you can look out in the field with the cows there, the herd of the cows, and all the cows around them are protecting the cow in the middle that might not be protected. And with something like measles, which is highly infectious, it's probably one of the most infectious diseases that is out there, you really need 95% of the people around you to be vaccinated. With COVID, because COVID is less infectious, it's somewhere around 70%. So you want, if you're in the middle of that herd, you want at least 70% of the people around you. The challenge with the children who aren't vaccinated is it seems like a small amount, but sometimes it's a large number in specific school systems. So it might be 2% for the whole state, but in certain school districts, it might be very higher. And I'm sure Jody has thought about that. So yeah, that in that point, in that situation, you may not get a protection from the herd. So it really is, we want a broad-based representation of people to get the vaccine. So that's not just 70% of one group, but it's 70% of everybody. Because infectious agents, they're clever. They will find the little leak in the roof to get into the population if not everybody is appropriately protected.
And again, I think we owe it to our community, to our parents. Again, I think Lisa mentioned that we want people to ask tough questions and we want people to be skeptical, not cynical, but ask the right questions and listen to the right people. And it's up to us as public schools and communities to ensure that people have the right information and that we continue to communicate so we can build trust.
I want to ask John a question again about the likelihood of the vaccine being mandated on college campuses or being mandated by an employer. How likely is that?
I think it's likely in both cases. Let me take the colleges first and employers second. So for colleges, we now know that the Connecticut statutes mandate the typical childhood illness vaccines. But I would anticipate that the General Assembly would add COVID once it becomes available. So my best guess is by next year or thereabouts, next fall or thereabouts, within the year of next fall, that we will be mandating the vaccine on college campuses. With respect to employers, it's a different proposition, but employers are mandated by federal law to have a safe work environment. And the presence of COVID, of course, attacks that safe work environment. So I anticipate many employers to require COVID as a part of doing their duty and maintaining a safe work environment. Now, the employers also have to accommodate people who have medical conditions and they can't have the vaccine or who have this religious exemption. But the accommodation has to be a reasonable accommodation, and sometimes that's not possible. It would be possible if you could work from home or work in another setting, but let's suppose you're the school nurse, it's not possible, right? You have to get the vaccine, you can't do it. So it'll be a situation by situation proposition. Employers are going to take this obligation seriously. We as employees have rights to personal exemption and medical reasons we can't get the vaccine. And then it'll be that usual beautiful, but sometimes not elegant dialogue, public health interest, public interest in general, and legal mandates. But I think it'll roll out really nicely. And I anticipate most states are going to embrace this. And most of us in our employment setting, we're going to be mandated to get the vaccine. But I also hope most of us, like me, are just going to go out and get it. It's not just to protect ourselves, but to protect our neighbors and members of our community.
So I want to
and I'll just add to that, John, is as long as the vaccine is under emergency use authorization from the FDA, we can't mandate an emergency use authorization vaccine. So you'll see that the health systems now that are giving the vaccine cannot require their employees to do it. But once it's fully approved by the FDA, then that will open up the possibility that employers or schools, and I certainly would anticipate if it has full FDA approval that we would ask our students at Quinnipiac to be vaccinated just as they are against measles and meningococcal disease before they come back.
And that's certainly the case with respect to healthcare workers. But the EEOC, the Equal Employment Opportunity Commission, the agency in charge of addressing the Americans with Disabilities Act and workplace scenarios, has opined within the last few days that they will allow the mandate in employment situations despite the emergency use approval. So it will vary by context, and is right now.
So I want to ask one last question and then wrap this up. There's a question still in the chat that talks about what is the time frame for what is the time frame for effectiveness of the vaccine? Are you okay immediately after the second dose?
I can answer that.
Great, Mary. Yeah.
What came out as of today is that you don't have immunity until about 7 to 10 days after the second dose that you receive.
Great.
So it is quite a while from that first dose. And I just have one more comment about parents who may refuse vaccines. Working in a pediatric practice, this is something that I deal with, on a frequent basis. And I think things like forums like this that provide information to the community are very important. Trust is very important. And I would never immunize a child with something that I thought was going to hurt them. And I think everybody, can agree with that. And so just giving out the education and gives a little bit of more reassurance out there for parents to agree to have their children vaccinated. So I appreciate this forum very much. Thank you.
Great. I am really sorry that we are out of time. I want to, we are putting up a list of resources for you now. This was one of the questions that was asked. It is a resource from the Center for Disease Control, the American Academy of Pediatrics, Children's Hospital of Philadelphia, and the World Health Organization. I want to thank you once again for our participants today for joining us tonight. Thank you so much to our panelists. What you shared with us was incredibly informative and I think really helpful for us to be able to make informed decisions. I want to share with you these resources that we use to get the most updated information to share with you today. And I would like to today invite you to join us for our second conversation, the part 2 for COVID vaccine community conversation that's going to happen on January 7th at 7 p.m. And you will hear from the panel of experts as well as an additional expert who serves on the governor's COVID vaccine advisory group. On behalf of Quinnipiac University and the School of Health Sciences, we wish you all health and wellness this holiday season. Be safe, be well, and go Bobcats.
Thank you.